Welcome back. Heart disease remains the leading cause of death in the United States, but here in Northwest Ohio, community leaders and healthcare advocates are joining forces to change that. Ashley Tahensky and Carly Salamoni are here this afternoon to talk more about the upcoming American Heart Association's Heart Ball. Good to see you, ladies. Thanks for being here today.
Absolutely. Thank you
for having us.
Yeah, absolutely. This is something that happens every year, right? The American Heart Association puts on. And Carly, this year you said, I'm going to be the chair.
Something like that, yes.
Something like that, yeah. So it's a beautiful night. Everybody kind of gets dressed up and has a nice evening. But let's start with the why first. Why do we do this? And give us some details on that.
Yeah, absolutely. So at the American Heart Association, the Heart Ball is one of our signature events. It's more of a gala-style event, bringing together local leaders, community influencers, physicians. Also our chance to raise critical funds for the mission and highlight our survivors, as well as provide some insight to the critical research that we are doing at the American Heart Association.
We're going to save some lives, right?
Absolutely.
That's the goal. And Carly, you don't work for the American Heart Association, but you work in healthcare, right?
Correct.
Yeah, so I imagine that's why you were like, you raised your hand and I'll do this, yeah?
Yeah, something like that, yes. So in my role with Vantage Healthcare of Ohio, we're a collaborative of rural independent hospitals across Northwest Ohio. And so really, part of my job is raising awareness about rural health disparities and about the great work being done in our rural communities. And so I saw this as an opportunity to raise funds for the American Heart Association and to help people understand the impact on heart disease for our rural communities and the work that our rural hospitals are really doing to save lives out there.
Now, what are some of the challenges that you would face in a rural setting?
Yeah, so on average, rural residents die from heart disease at about 1.5 times the rate of their urban counterparts. And it's really an access issue a lot of the times. We see that they're less likely to get regular, ongoing, routine care. But then when there is an emergency, especially with all the news around rural hospital closures, you're further away from that care, and so you see higher rates of people dying or having complications. So
yeah, and time is of the essence when in a situation like that. So talk a little bit about what the American Heart Association is doing to help work with rural hospitals and helping to maybe change some of these statistics.
Yeah, absolutely. So by putting together the Heart Ball, we're raising those critical funds. We're really working to provide certified action plans and really implement AED and CPR plans in place. So like you said, time is crucial. So every minute is a 10% chance of loss of life. So you really want to ensure that you're getting hands-only CPR started right away, really rolling that out to the community and how they can participate in hands-only CPR and provide the knowledge and funding and education to everybody around them.
Yeah, well, yeah, and that's a little bit helpful if more people, the more people who know how to do this and are willing.
Yeah, exactly, and really pairing some of the programs that the American Heart Association does nationally with our rural hospitals and some of their stroke certification and their gold standard heart health certifications that they have, getting them connected with our hospitals, and then helping the community learn about the fact that the hospitals do have life-saving resources that they provide in terms of cath labs and heart attacks and being able to help get them in time.
Yeah, and during this event, there's always some really wonderful stories that are shared. You said you highlight the survivors too, and they share those stories, and they help others to maybe have some hope or spur them to make some changes or help others in other ways, right?
Yeah, absolutely. So don't want to give too much away, but we have a featured survivor, and then we have 3 different pillars. So youth, a middle age, and a senior survivor. So really highlighting that heart disease really does affect everybody at any age, no matter how big or small you are.
Yeah, so we want to get that word out there just to pay attention to what's going on with your body, and this doesn't feel right, maybe go get checked. As you mentioned, in rural settings, folks might not go and get checked as often as they could. Yeah.
And I think one of the big things, or one of the big misconceptions, is that you have to physically be unhealthy to have any kind of heart condition or heart disease, when really there's so much of it that's genetic, right? Sure. You can be, and you'll hear a little in our survivor story, right? You can be the most in shape, healthy person, but genetics is really a key factor, which is why it's so important that everyone's being educated and everyone's getting screened and everyone's going to their doctor regularly.
Know your numbers, everybody. That's
Yes.
that is the takeaway today. This is the QR code. You can make a donation to the Heart Association. Their tickets are closed, so unfortunately, not this year, but next year, make plans to be there. This is at the Hilton Garden Inn, and our Kaylee Kirby from our morning show is going to be there to MC this. But donations are still welcome if you want to help out with this cause. Ladies, thank you so much for being here today.
Thanks for having
Thank you.
us.
Have fun. All right.
We will.